The Singapore government is repeating calls for employers not to request for medical certificates or MCs from their staff who test COVID positive. The healthcare system is facing further strain from people visiting clinics to get MCs even though they have mild or no symptoms. Lauren Ng tells us more.
It's not just general practitioners. Polyclinics and hospital emergency departments continue to see an influx of patients with mild or no COVID-19 symptoms seeking medical certificates to submit to their workplaces. This comes despite a directive by the Ministry of Health earlier this month that allows employers to accept a positive ART result as proof of infection. Manpower Minister Leng reiterates that these visits are not necessary.
I think that we have gotten quite a fair bit of reports, both from social media and also from colleagues, that the healthcare system obviously is facing queues. This actually can detract the main patients who are ill, who seek medical attention. You could actually sort of disrupt their ability to seek medical attention.
Instead, he says employees should just recover at home, and there's no need for a recovery memo for them to return to work either. They can head down to combined test centers or quick test centers if they want an official infection record. Tests at these centers are free until 15 March. Still, there are concerns over absenteeism and the possibility of people pretending to be ill to avoid work. But one company says it's all about trust.
I think we are blessed enough to have a tight-knit group of people who will work for a long time, so we trust them. Yeah, so it's not a case where we have to dig down and make sure that they're not lying or what. It's more like a matter of trust.
Still, 2 employees who tested positive for the virus submitted their medical certificates, even though it's not required. In the long run, authorities are generally optimistic that the rise in cases is just a phase, and the strain it's putting on clinics and hospitals should subside after the surge hits its peak.